Good morning. The e-content for this month, the topic is Sailography. Sailography is nothing but a radiographic demonstration of major salivary glands using an radiopaque contrast medium, which is introduced into the rectal system. It is very useful and effective in the diagnosis of if there is any obstruction in the gland or if there is any swelling associated with obstruction in the gland. It is considered as gold standard investigation technique for autoimmune conditions like Sjogren syndrome. So most of the dye, which is all the contrast media used is iodine based dyes. So the major indication for xylography is to detect the calculi or calculus or any foreign body which is either radiopaque or radiolucent and used to determine the extent of the destruction of the gland due to any obstruction or presence of a calculi. It is also used in detection and portrayal of fistula, diverticula or any strictures used in the diagnosis of recurrent swelling and inflammatory processes, and sometimes allography is used as a therapeutic procedure. In case of small presence of small calculi, where it is introduced, the contrast media is introduced to push out the small salivary calculi from the ductal system. So the major contraindication is when the patient is sensitive to iron compounds or the iron-based dyes, it is mainly contraindicated and it is not used during the period of acute inflammation of the salivary system, where the epithelium is restricted and the contrast medium could escape into the parenchyma, causing severe foreign body reaction and severe pain. So the major procedure, it has three different techniques known where the how the contrast media is introduced into the ductal system, which includes simple injection, hydrostatic method, or continuous infusion infusion of the contrast media where the pressure is always monitored. The procedure is divided into three phases: pre-operative phase, where the patient is prepared for introduction of the dye; filling phase, where the dye is injected; and emptying phase is the post-operative procedure where the dye is emptied by asking the patient to suck a lemon or continuously drink water. So coming to the normal xylographic appearances, the parotid gland appears as a tree in winter or leafless tree appearance. Since it has multiple branches, the duct is divided, or duct of the gland is divided into three different branches. Whereas the submandibular gland, it appears as a bush in winter appearance. So, describing the xylographic appearance of the various salivary gland diseases, when there is a calculi, there will be a filling defect. The dye will be obstructed from flowing through the duct, and there will be a filling defect. And there is post to the calculi, there will be a ductal dilatation proximal to the calculus. And it gives a sausage-like appearance. And in case of xylodorchitis, the appearance is sausage-like appearance, whereas like there will be a filling defect and strictures appearing through the ductal system. And in case of xylidinitis, it appears as dots or blobs of contrast media in the gland. And this appearance is known as xylectasis, where there is the inflammation of the glandular tissue, producing a sacral dilatation of the acini. And in case of a Sjogren syndrome, it appears as a fruit ladder or a cherry blossom appearance, where like snowstorm appearance. In case of tumors, the xylographic appearance of the ductal system would be like a ball in hand appearance.